This is something that I'm really pleased that you asked me about. Dr. Nagat, is topical estrogen advisable for all menopausal women, regardless of UTI status? I'm going to talk about topical vaginal estrogen because that's different from topical estrogen such as patches or gels, which is systemic and goes throughout the whole body. And that is what we use for a whole load of menopausal symptoms. And according to NICE, is first line treatment for the treatment of menopausal symptoms or perimenopausal symptoms. So let's have a look at, firstly, let's go back to this anatomy that I use often to explain why estrogen is so important around our vagina and our bladder area and also our pelvic health as well. The reason being is because estrogen has so many roles. It's an immune modulator, it lubricates all our blood vessels, and also estrogen is so important because it has a functional aspect in the integrity of the bladder barrier by reducing the inflammatory processes. And also what it does is it keeps the balance of the pH of our bladder and the urine. When we are younger, so if you look at the mucosal tissue, you can see it's lovely and thick and there's lots of immune cells. The barrier is brilliant. It keeps us protected against urinary tract infections. And then when we are in the perimenopausal phase, so that's when we start decreasing estrogen, you get atrophic changes of vaginal mucosa. When you get that, you get a reduction, as you can see, in that barrier. You get a reduction in the immune system trying to provide integrity around that area. And it means that common bugs that are there can flourish as well and cause an inflammatory process. Inflammatory process can cause a whole load of symptoms. Topical vaginal estrogen is so important for the treatment and also the prevention of vaginal atrophy, or otherwise known as genitourinary syndrome of the menopause, GSM. And this is because when you're getting decreasing estrogen, it can cause inflammation. And this is a reaction to your body having less estrogen, and it can cause all these symptoms. I've taken this from my lovely friend Claire, who is from Lichen Sclerosis UK Awareness, and also does a lot of work around bladder and pelvic health. Well worth checking out her page. But it's more than just urinary tract infection or a bit of dryness. Yes, you can get dryness. You can also get a burning sensation. You can get a discharge. Some women say, actually, Dr. Nagat, I don't get a dryness, but I get an overproduction. And if you're around the perimenopausal age, or also when you're breastfeeding as well, that's when we have another decrease in estrogen. Remember that you can get an overproduction of this sort of discharge that is there, and it's not because of a sexually transmitted disease and you've ruled that out, and also because you ruled out other infections like bacterial vaginosis or thrush, such as Candida albicans, which also sits around our pelvic floor, bladder, vulval, vaginal tissue area. It can also cause this recurrent itch, which gets mistaken by a lot of doctors and my colleagues as this is just thrush and a woman is given Canesten consistently. No, we need to be thinking about vaginal atrophy. Urinary tract infections you can get more of as well. Urinary incontinence, that means coughing, sneezing, and you get like a lot of urine in your leaking out. That also can be a part of it as well. Bleeding after intercourse, discomfort, so on superficial or deep penetration. And also you can get a decrease in vaginal lubrication during sex, and also tightening of the vaginal canal, or even unable to have sex. And sometimes women find that actually in sex they're absolutely fine, but what happens is when they come in for a smear test, that's when they noticed, oh my goodness, actually that smear test was really painful. So we should be giving vaginal estrogen to those women and saying to them, right, well, we're not going to do the smear test today, get you to use topical vaginal estrogen like Vagifem, and then you come back 3 months later to have that treatment. So topical vaginal estrogen like this is Vagifem. There's a little tablet at the end, and you push the plunger down. This is otherwise known as Gina. You can buy it over the counter for those that are over the age of 50. And it literally is what it says on the tin. It provides estrogen back into the area. So is it advisable for all women? I would say yes, especially if you're getting in there early enough. Around the age of about 40 is when I would advise some women as well. Alongside this, you can have what's known as a vaginal moisturizer, such as Hylofem or Yes Organics. A moisturizer just replenishes that skin back. So in the ideal world, Yes, I would be saying to women who are perimenopausal and those that are breastfeeding and it's not thrush and it's causing them vaginal symptoms to go on topical vaginal estrogen like this. Talk to your GP or your healthcare provider in order to make sure that they can help you with your symptoms.